Mini and Nitya, good evening.
You're busy preparing list.
Father,
Good
one
evening.
question.
Putting the list, I send it
Yeah.
in the admin group. Okay.
English, Malayalam, no English. Please, you are online. Yes.
Yeah, Father,
Yeah.
is there
Anyways.
someone from the community WhatsApp? They are not in the. If they ask for Zoom, can I send now or I will wait? You will
No,
post
they will
in the.
come. No. Notice is clear. They will come to YouTube comment, collect it from the
Okay.
YouTube comment space.
Okay.
Yeah.
Okay.
That is repeatedly said in the notice. That will be the tradition.
Okay.
Only those who are reserved. Otherwise, there is no meaning in taking this list and all these details. Yeah. There will be some discipline. Otherwise, our Bayama will cancel everything. Bayama is the associate chief admin now. Yeah. She'll teach discipline. Okay. That's it. Those of you here, if you can connect to YouTube comment space, just post some message there. Where are you from? So others will follow. Just good evening, good afternoon, good morning. Please type in where are you from. Rebecca, good evening, Rebecca. Yes. Monsi, please send the link further. Yeah, those of you who have reserved the slots, the link will be sent in 2-3 minutes. Okay. Soon we'll be sending it. Yes. No power. Yes. Yeah. Yes. Can we get Zoom link? Definitely, we'll be sending you the Zoom link. Those of you who have reserved the Zoom classroom seats, you can enter. Yes. We'll post in 2 minutes. We'll be posting the Zoom classroom link in the YouTube comment space. Those of you who reserve the seats can enter. Others will have to attend at YouTube Live. Yes. At the same time, see that if you have 2 instruments, keep sign in to YouTube even when you enter the Zoom classroom, because if you are not successful in entering, even other ways to interact, if you have a second instrument, that will be great to attend the session. Yeah. If you have one more instrument, one more phone, please grab it. Yes. No power here. I don't know how far we'll be able to. Now let's check. Yes. Yeah, we'll be starting soon. Please type in where are you from, Father. I have already served the morning itself. Okay. You'll be getting the link soon. Yeah. For those who have reserved the Zoom classroom slots, you can use the link which I'm posting in the comment space. The Zoom link is posted in the comment space from Edu Skills. Yeah. Please mute. At the Zoom, please mute your audio. If you are using a second instrument, see that the second instrument is mute. Always keep the second instrument low volume, 0 volume. Those of you in the classroom, yeah, Zoom classroom. Yeah. Can check the list, okay? Mini, Nitya.
Yes, Father.
Accordingly, can admit it.
Good evening, Father.
Good evening. Yeah.
Yes,
Good
Father, I'm
evening,
doing
Father.
great from
Good
Kerala.
evening.
Thank
Good
you.
evening. Good evening. Welcome. You're welcome.
Hello, good evening,
List
Father.
in the chat
Very
box.
good evening. Today mostly will be both reading and listening, but the focus will be on listening because the previous batch they missed some of the classes for listening. So we are trying to give them as well some tips. At the same time, you will also benefit. Yeah. There is no power. I don't know how far we'll be able to go on. You can see me, right? I have a very
Good evening, Father.
good evening. Very good evening. Yes.
Good evening, Father. We are waiting
Very
for
good.
2 days.
Very good.
Thank you,
Very
Father.
good.
Thank you for adding.
Yeah, Vardhan, I don't know the number of
Thanks.
participants.
Thanks for admitting.
Majority are admins here, so they don't require all these classes. They are experts in that. But then we don't have sufficient students, so we will have to think what to be done. Yeah. So before current fails, we'll begin, I believe. We'll not wait much for others. Nitya,
Yes, Father.
yeah, admit as early as possible. We'll begin because there is no power here. My little bit of lack of exhaust. So I think we'll, yeah. And those of you who came here, see that if you can connect a second instrument and be connected to YouTube and interact there, so that they also get involved. Welcome everyone. Yes. Just type in where are you from. Beshiragi, hi. Beshi, how are you doing? Where are you? You're back to Kerala or in Gulf? Good evening. Yes, Vali Prabhakar Sudaresh, good evening. Yes. Good, yes.
Nitya, do you know this one? Sarah, this is our admin.
I don't know many. No, that is not.
Okay, these 8 members, they didn't mention their name in the YouTube before.
Lakshmi. Varsha, did she mention? No?
Varsha is joining.
Did you, those who joined here, did you sign out from YouTube? Please go and send a message there. Those who are in Zoom classroom, those who just entered. Send a message there, I am in Zoom classroom. That helps us to assess the participants' participation later from the chat box. Those of you are admitted here, those who reserve the slots, just send a message at I am at Zoom classroom. That helps us later to assess and identify the people who the attendance. Just type at Zoom classroom, okay? If you don't have a second instrument, you can just, yeah, good evening. You can connect from the same phone, no problem. Click on the link, yes, Satya, good evening. Yes.
I'm Satya Sasin Father.
Okay.
Sasin
from?
Satya Father from Singapore.
Okay, good evening.
Singapore
Welcome.
Father.
Welcome, you're welcome. Yes, Satya. Yes.
I'm very happy Father today.
Yeah.
Because I joining the live Zoom session. I'm ready for night duty Father. I'm ready already. After finishing the Zoom live session, I go to my duty Father.
Okay.
Thank you Father.
You're welcome. You're most welcome. So we'll begin, I believe. Minnie, shall we start?
Yes, Father.
Is it okay to start?
Yeah, we'll start, Father, because 9 members on the waiting room. They didn't mention their name before.
Okay. They will attend at YouTube live, please. All those who are here, just send at Zoom classroom, okay? Mohammad Isha, that is Zoom classroom. Seema, that helps us later to take the attendance. Just at YouTube comment space, just post at Zoom classroom. I am at Zoom classroom, yes. Just yes will not work. Okay, Rebecca, we need I am at Zoom classroom because yes, there will be so many yes. So we can just filter it Zoom classroom attendance. Yeah. Just send it. Zoom classroom is fast.
Good evening, Father.
Good evening, everyone. Yes. Yeah, I think we can stop admitting, I believe. Many Nitya admins, you can stop admitting because already time for 45. Okay, good evening and welcome to Edu Skills OET Medicine. It's sorry. Yeah, power came. Yes, good evening, good morning, good afternoon. Good evening and welcome to Edu Skills OET Medicine. It's our mission to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work. And share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially and emotionally struggling to crack OET. And today we have the fourth session of this new batch. Today will be, again, the foundation program. Mostly we'll be dealing with certain principles of hedging words and how to analyze the question and find out the answer easily. So those tips will be shared today. And basically, we'll also deal with some listening audios and scripts, how to deal with. This is also the same strategies as I used to say for reading as well. Yes. Let me share my screen, even at the YouTube comment space. Let me know if you can see my screen. Yes. Those of you who have not reserved the seats for a Zoom classroom, we'll try to admit you after some time. If there are slots, yeah. Yes, but till then you can keep attending at the YouTube comment live session. Just let me know if you can see my screen at the YouTube comment space, if you can see me, if I am audible and the screen is visible. 3 things. If 3 things are okay, type 3 hearts. Just send me 3 hearts. Yeah, should be yes. I'm not, I'm outside home. I will join with YouTube for a cool. Echo, okay, that's cool, Mukta. CG, Rebecca, yes, 3 hearts, yes, at YouTube comment space. But I can't see why is that. My screen in the YouTube comment space. Okay, Edu Smart Batch 2025, session 4. Okay. And at Zoom classroom, if there are beginners, please mute your audio. Mute your microphone. All of you, please mute your microphone. Only those who are familiar with the session or the Zoom classroom can interact. Others can just listen, okay? Yes, for listening skills. Let's see. Yeah. The first question, hope most of you have attended yesterday's 3rd session. You will have better understanding. Sorry, there is some issue. Let me know if you can listen to the audio, okay? This is the question. Can you tell me what is the hedging word in the question stem? This first line is known as the question stem, first and second line. You hear part of a morning briefing on a hospital ward. What is the plan for the patient
Father,
today?
the screen
Yeah.
is not. The
Screen is not visible,
big.
Father.
All the
Not visible.
yeah.
Okay, let me share again. Now?
Yes, Father.
Yes. Now okay.
Father.
Let's check. At Zoom, YouTube, it has not reached, right? Had to reach, okay. Yeah, tell me what is the hedging words, key words in the question stem, the first 2 lines.
Plan.
Plan.
Plan, more than that. Plan, okay,
Today.
plan for patient today. I'll highlight it, plan for patient today, okay. Today is very, very important.
Hospital watch.
Because that is a
Hospital
time
watch.
expression. Today is a time, this one, time expression. Hospital ward. Okay, that is the context. Morning briefing. Yeah, these are very important. Morning briefing and today. Okay, they will speak when you see such a hedging words. You can think of as you saw yesterday. It was about Chagas. The short time solution, short term solution was the thing. So you will have long term, medium term, and short term. So you'll have to distinguish. When they say plan for today, they might speak about plan for tomorrow, plan for yesterday, or discharge plan, different plans they will speak. You are supposed to listen to plan, what is the plan for the patient today. And when it says morning briefing, they are speaking about a patient who was already there. Okay. So first option, A, her emotional state will be carefully observed. What is important?
Emotional state.
Emotional
state. Okay. Emotional state. She will be transferred to a more specialized unit. Transferred. There is no doubt, because that's the important thing there, right? To where it's not that important as transfer. Okay. A social worker will come to see what help she needs. Social worker. Okay. There's a great clue here where you can use in most of the answers. We call it tense, the clue regarding tense. Now, today is past tense, present tense, or future tense?
Future. It means present tense.
Yeah. Today, present tense. And third answer is?
Will
come. Yeah, probably that will speak about the future, may not be today. Okay. A clue that you can keep in your mind. You not conclude with that, but sometimes you can check out when you practice. Usually that cannot be the answer if the tense is different. So listen to now, emotional state or transfer or social worker. Only three things you have to listen to. Okay, today's plan, what's going to happen? Are they speaking about emotional state of the patient, or are they discussing about the transfer, or are they speaking about a social worker who is to come? That's all you have to listen to. That's how you have to analyze this within 30 seconds. Golden seconds, we call it. Okay. Listen.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
Any clues?
B.
No, I'm not concerned about the answer. We don't want answer. We want some lights, enlightenment on any of the options. It need not be right option or wrong option.
Social worker will come tomorrow.
That is
Okay.
tomorrow.
So what is the question?
Question is
Plan for today. Yeah, social worker will come. As I said, the future tense was there, so we concluded that we'll eliminate it. Yeah.
Close observation, like emotional status.
Every 15 minutes observation.
Every 15 minutes.
15 minutes for the close observation.
Did they speak something about transfer? score and right answer. When you practice, it's none of your business. And some say, I'll take a lot of time. Take a lot of time. Maybe take one question and sit for 2 days, no issues. Provided you are practicing, that will enhance your competency. Then finding questions, finding answers. Otherwise, you can just go to the key and find the answer. Why should you get the answer? Because by just guessing the answer, you don't learn anything. Okay, let's listen one more time. Think of only emotional state and transfer, okay? That's why we have the keywords or hedging words or the important words highlighted. Think of, now this is already eliminated. If you have not understood, you can listen to that again. Otherwise, think of what do these people speak about the patient, a female patient, emotional state or transfer?
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
Yes.
Overnight transferred. Overnight
Yes.
transfer.
Overnight transfer
Transferred and
overnight transfer says
high
morning briefing,
dependency
right?
unit.
Same
High
day.
dependency unit. Okay. The main issue, you have to consider what is the main issue, when condition the
State.
patient is admitted for. And usually the
Emotional
answer will be
state.
connected with the main condition. And
She's schizophrenic and she needs emotional support.
yeah, and maybe 70% of the later portion is about tomorrow. Social worker and other things about tomorrow, which we are not concerned. That's why I said when there is a time expression in the question stem, always concentrate on time expression. Please mute when don't disturb, please. Those who are not familiar with the Zoom classroom, please don't unmute at all, okay? See, when that person, you can send them off admins if you can see them. Because please, those who are new to Zoom classroom, please mute your microphone. Don't speak. Others will speak. When you are familiar, you can do that, okay? Because whatever you're speaking in your kitchen is heard here. That disturbs the whole classroom. Yes. Hope I'm clear. That's cool. Okay. Now, what is the conclusion?
Option A.
Option A is the correct answer.
Option A is the correct answer.
Why?
Because stay back,
why not
still
B?
the condition improve.
B answer B. I will take because high dependency
topic
unit.
sentence is regarding schizophrenia. So main problem is patient is suffering from schizophrenia, so he needs emotional support.
Yeah. Why not B? Reason
B
to eliminate B?
Combine the high dependency unit.
Okay. Transfer is not possible, and they aren't speaking anything about transfer, right?
Yes.
So it is not given, right?
Yes, Father.
Yeah. This is third one. C option is future tense, not today, tomorrow, and this is not given. And the whole thing, the initial portion speaks about emotional state and also the main condition for which the patient is admitted is schizophrenia and which requires emotional support. Repeatedly, they mention emotional state. Let's check out.
Yes. Father?
Yeah.
Father?
Yeah, please.
Option B, in that will be is there, no? That also future only, no?
Yeah, will be transferred to a more, that's also a future thing. Maybe you can conclude there also, you can conclude if you want, but that's not the final thing. But yeah, even in the first one, will be is there, but why I'm saying will come, will be transferred, will come to see what help she needs. Will be is there here also, first one also. Okay, that's why I said there is a not, will be is not will. She will be transferred in the future. Emotional state will be careful, be observed. Okay, sometimes the tense will clearly guide you, but then here, that's why I said don't conclude with it. We did not eliminate, only when. Yeah.
Here it's already said overnight transferred and will remain in same place.
Yeah.
No? It's already.
Yes. Yeah, just she came previous night and only they are in the assessment process, right? So transfer is not contemplated at this stage.
Until the condition is stabilized, she should be in the under observation, right, Father?
Yeah, because morning briefing, they say the emergency ward, admitted to emergency ward, she is serious, she admitted, got admitted this night, previous night. Okay, so immediately they can, normally they won't think of immediate transfer or immediate, what you call, social worker coming and all those things. That comes in management stage, right? Now, what I'm saying from the general assessment, it can happen if somebody will be immediately transferred. There are exceptions. But in general, what happens? So here, you know, social worker, when will the social worker come? Not in the initial stages, right? It's in the management stage, not in the diagnosis stage. Social worker usually comes after discharge. Normally. Yeah. Follow-up programs, management, not in the initial stage. As soon as the patient has come. If you know, because you may not have that clear idea, because in India, social workers are not connected with hospital. But when you go to other countries, they are part of your medical team. Okay. Yeah. Yeah, we'll go on a little more explanation as you come to the text script, you will understand better. Okay. So morning briefing is important. The patient today, plan for the patient today versus discharge plan. Okay. Discharge plan is for later. Emotional state transferred, social worker will come. See, context is very, very important. Okay. Morning briefing. So morning briefing means today, right? Every day. Yeah. So context is very important to understand the timeline. Morning briefing, plan for today. Morning briefing tells you this is the plan for today. Okay. And rest of the things they are just discussing, not morning briefing. They are discussing about the future plans. Morning briefing doesn't include. Morning briefing includes what after the admission, what happened. So they speak only about emotional things. Okay. Now, what is your next business? Yeah, multitasking. Listen, read, and underline or write. This is very, very important. You take it, most of the people take it very silly, okay? But we are not trained into multitasking. At the most, you are trained into dictation and writing. Okay. Yeah. You don't read. In the schools, something will be dictated and you'll be writing, or you'll be copying from the board. There also you are not listening. You are just reading and writing. Here, this is a special skill, multitasking, where you have to listen, read, and write during the exam. You have to listen to the audio, keep on reading the question and answer options, and at the same time mark the right answer. So all these three tasks you have to do simultaneously, for which your brain is not trained. So smile and do this multitasking, okay? And underline whatever is important. If you find some clue, different ways, people can find it different ways to answer. Okay, however you understand, you can discuss it here. That may help others. Okay, now we'll play it again.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We will consider that at tomorrow's ward round.
Okay. Anything that you underlined?
She is to be remain high dependency unit care under
Paranoid schizophrenia.
Okay.
Will be
That is,
observing her
okay. One. Give me 1 sec. I'm trying to reduce this. Okay. Sorry.
We will be observing her every 15 minutes and monitoring
Okay.
her.
Yeah. Paranoid schizophrenia is the main condition that you have to listen for. Yes. Then overnight admissions tells you morning briefing. Yeah. Then department.
next to remind.
History of she presents with chronic persecutory high dependency. Yeah, high dependency. High dependency means she needs. Yeah, until the stabilization of her symptoms. Yeah, we will be observing her every 15 minutes and monitoring the level of her distress, psychosis, and response to interventions. What is that? That is again emotions, right?
Yes.
Yeah. And the response again. All these things we speak about emotions. Okay, that is a part of briefing. Then okay, she responds. Okay, we'll review the clinical and detention status this afternoon. See, this afternoon also today. Now, what's the plan for discharge? The question is there about discharge, not transfer. Sometimes people confuse between transfer and discharge. Okay, so beware of these distinctions. They are in the question option, answer option. Second answer option speaks about transfer, not discharge. Okay, that also is very, very, very useful for your writing. Sometimes they will ask you to write a transfer letter. Some people will write a discharge letter. So the whole thing derails. No, you think it is very simple. You know it, but it happens when you're in a stressful condition. And I have seen so many people doing that. That's why we are telling you. Social work interventions required for placement and community support options, and that's been booked for tomorrow. See, tomorrow is not relevant for us because the question 7 speaks about today. Yeah,
Today.
all these clues I am giving because if there is a confusion, if at all you don't find the answer, you can analyze the whole thing. Okay, when you revisit, not in the first go. In the first go, you have to answer whatever you know, and mark and go. Skipping is a very, very big, great skill in OET. You have to practice it. When you practice, you have to practice it. Otherwise, you won't get that skill. You will be stuck with one question and you will not have time for other questions. So whenever you don't have a confusion, immediately skip. Even when you practice, maybe out of 40 questions, you in the first go, you might answer only 15. It is cool. 25 skipped. Next option, next round, you will answer another 10. Next round, you will answer another 5. So practice it that way. Then you will be fast in the examination hall. Also, an application for the appointment of legal guardian may be required. May be required tomorrow. Not right. We will consider that at tomorrow's. So tomorrow's ward round. What is that? Application for the appointment of legal guardian. So that's also tomorrow. We are not concerned. So that is clear, right?
Yes, sir.
So yeah, that's
Yes,
it.
Father.
How you go. Yeah, that's beautiful. If you practice and become competent, that becomes very, very easy. So you see, observing her every 15 minutes and monitoring the level of her distress, psychosis, and ready response to interventions offered. discharge plan, social work interventions required but tomorrow, consider tomorrow's ward round, all these things. Now, see synonymous, not synonym, synonymous. Synonym means different words, same meaning. Synonymous means a group of words indicating another group of words. Here you see overnight admissions indicates to morning briefing.
Morning briefing.
Yeah. Then see emotional state, persecutory and paranoid delusions, all these are emotions, right? And chronic, persecutory, paranoid schizophrenia, all these things indicate emotions. Okay. So time expression and sequence. Today's plan, discharge plan. Briefing, time expression, morning briefing. This afternoon, time expression. Tomorrow, time expression. Today, this afternoon, tomorrow. Okay. Now, why this afternoon is today, right? Why are you not concerned about it? Why are you not concerned about it?
Morning briefing only they're asking.
Yeah, exactly. They are asking morning briefing. In the question stem, they are speaking about morning. So you are not bothered about afternoon, evening, night, tomorrow, day after tomorrow, all those things. Exactly. That's what you have to fix in your brain. Okay. Morning briefing is the hedging word. This is the importance of identifying the hedging words. So I ask you, always request you to spend more time on question and answer options, understanding it, not the text. And good deal of time, you will see you don't require the text or audio at all. You will have almost 99% accurate answers given. Then when you listen, you just confirm it. Okay. Time expression and sequence, today's plan, discharge plan, morning briefing, emotional state, see, afternoon, clinical detention status. Okay, tomorrow, social work to visit, morning briefing, afternoon, tomorrow. This is the sequence. Time sequence. Okay, morning briefing, emotional state. Afternoon speaks about clinical and detention status. Then tomorrow speaks about social worker visit. This is what I even yesterday I showed you. Exactly, you have to analyze, write down these things. Spend some papers, no problem. Create some pictures and all these sequence. That's why I give you a model. You have to practice that way. It's not understanding. That's only knowledge. When you practice, you have to acquire this skill only by practicing this time. Okay. You know how many slides, PPTs I prepare on each one. Discharge plan. Tomorrow, social worker, discharge plan. See, morning briefing, afternoon, tomorrow, then discharge. We will discuss about discharge later. So the sequence is there. Okay. That is cool. Yes, maybe you can have 2 minutes if you want to grab some snacks or something. Okay. By the meantime, so if you want to ask something, some clarification, we'll be going to the next segment. Okay, next question. If you want to ask something, you can ask me. Let me have a little something. Yes. Anything you want to ask me, you can ask me now. Nothing? That YouTube comment space? Yes, those who are here, just send a message there. Let them feel comfortable with the session. Yeah, Beulah, yes, Father, great, yes. Merlin Johnson, yes. Yeah.
Yeah, Father, for listening, is there some particular accent we need to be familiar? Then only we are able to.
Accent usually, no, as you practice, you will be familiar with the accents, right? British accent, Australian, and American. Usually British and Australian happen in the audios. But even otherwise, when you know one accent, you will be able to understand the others as well. That's why I said, whatever you are interested in, just listen to that. Maybe if you are interested in cricket, maybe in coaching, they are having football match next recent future. So if you are interested in football match, if there is commentary in English, listen to that. If you have some BBC news, listen to that. Always I ask the people to face the TV, if you have a TV, to the wall. Okay, and just listen. Don't see the screen. Just listen the news, English news. By seeing, you will not enhance your listening capacity because you will be understanding from the visualizations. So always listen to something. Even when you are cooking, you can listen to something. If you have some kids, you can interact with them in English. Yeah, you can explain to them certain things. You can listen with them, listening audio. This small audio, you can listen with some kids. If you have some primary school kids at home, listen with them and ask them what's the meaning and discuss with them. That will give you more clarity, and listening accents will be that happens automatically. You need to practice any accent. As you keep on listening to, you will be able to understand. Do you think these accents are difficult? When they speak, they are very slow. Right? There's a conversation, there's a connection between the dialogues, so easily you can understand. Yeah, mostly I feel Australian and British accents, because this is OET is connected with Australia and Cambridge University.
Thank you, Father.
Thank you, Father. Anyway, thank you. Wonderful explanation. Thank you so much.
You are welcome, most welcome. So if we have no concerns, we'll go to the next segment. Ready?
Yes, sir.
Yes, Father.
Yes. Yeah. And one more important thing what I want to tell you. One second. Sometimes what happens, you will find the same material, you will think this is the same video. No. Because maybe with one audio or text, I have taught you 1 or 2 tips and strategies one day. Next day, I will be teaching another 2 or 3 strategies with the same audio or same reading. So don't think these are the same materials I know. That's one of the traps you have. Then I need not take the same material. We have been trying not to repeat the same materials. But if I have repeated, you will have more strategies and tips and tricks explained in those videos. Do you get my point?
Yes, Father. Yes, Father.
Yeah,
Yes,
yeah.
Father.
So maybe the material is same, but the explanations are never same. There will be more and more things. So always you have to go, or when you think of the familiar text, same text, it's easy for you to understand different strategies. When you take a new text, it will be a bit hard for you to understand in the initial stages. Okay. So already many of you are concerned about elimination. You are reading the book and all that. The book which I recommended is not mandatory, okay, because whatever is important, I have summarized and taught here. But if you have a general habit of reading, if you want to improve your reading habits, you can read that, okay? It's a very scientific book. Yeah, in the previous session, I gave you the link. Okay, now elimination skills. We have already seen some. Okay, we will eliminate the absolute, eliminate the wrong ones, look for precise language, straight opposites, radical answers, educated guess, and random guess. These are the 7 skills of elimination. And now we have seen eliminating the absolute and straight opposites. We'll be clarifying those things. A few more explanations with some other audios as well. Okay. If you have not attended the previous sessions, always see that you attend the previous sessions. At least watch the videos and come for the next session. Otherwise, you may not understand half of the explanations. So one thing was eliminate the absolute. I'm not giving you the basic things because you know those things. Eliminate the absolute means avoid north-south options, extreme values. All, few, always, never. Such extreme options, yeah. Search for clues, words like never, all, every, always, none. All these are the absolute words, okay? These are not scales. These are absolute words. If they appear in one option, any answer option, immediately you can eliminate that option. But don't believe me, okay? Only from your practice, you should confirm it. Okay? Don't believe me. And but at the same time, a caution is this: meaning should be absolute as well. Absolute word should be used, and meaning should be absolute. When you say all nurses are not happy, that's not an absolute statement. Meaning is some nurses are happy. Okay. So meaning very important. Okay. Because there are people who send me some message saying that, Father, there is an absolute, but that is not the answer. That is the answer. That it cannot be eliminated. That's a common. Yeah. This is audio. Okay. This is a text from reading. When seeking consent for a post-mortem examination, it is necessary to. What is the hedging word?
Consent.
We are taking writing and reading together because to tell you that it's same strategies and tips used in both writing and listening. Reading and listening. In reading, you read the text and understand and answer. In listening, you listen to the audio, understand and answer. But the strategies are same. So this is the question, Sam. What is the important word?
Consent.
Consent.
Postmortem.
Yeah, postmortem. Yeah. Initial stages you can highlight postmortem also, but when you are competent enough, consent will be enough. Okay. Postmortem you can highlight now, no problem. Beginners, it will be helpful. And necessary to. Necessary. Necessary. Any synonym you remember?
Must.
Must. Yeah. Yeah, must. You must. Now give a valid reason for conducting it. What is it? Conducting it means it is it is known as a referent. What is it?
Examination.
Yeah, okay. Postmortem examination. So what is the hedging word here?
Valid
reason. Valid reason. Okay, valid reason. Valid reason. Then allow all relatives the opportunity to decline it.
All relatives.
All relatives. Yeah. What is all?
Absolute.
Absolute. Is the meaning absolute?
Yes.
Yes.
Yeah. Just I am eliminating it, but don't believe me, okay? Only from practice you have to, don't believe me. Only from practice you have to confirm it. Now we'll see. Look into the text and see whether the elimination is right. This is from the official OET material. Okay. Thank you, OET, for allowing me to use this for teaching purpose. Only raise the subject after death has occurred.
Only
absolute.
Only is the absolute. Only is the absolute, and after death you can highlight if you want. But then Edu Skills says only is an absolute, so eliminate this. So don't believe me, okay? Only when you confirm yourself and practice. Don't believe all this nonsense. This is from the official material, and we have not seen what is the text, right? And why should you spend so much time? This is from official OET website. We have analyzed and we have the ebook on all the 5 materials, reading materials from OET website, which proves that all these techniques will work. Okay. In all the 5 texts we have proved, in A, B, C part, we have proved all these strategies and tips. Now you know how much time you require to do this if you are competent. What duration you require?
Seconds.
Couple of seconds. As soon as you read, even if you don't read anything, if you find all and only here finished, you eliminated, then you have only one answer left. That must be the right answer, but don't believe. Okay. Yeah. From your practice, you can believe. Okay. Now let's get into the. So we have eliminated it. Let's get into the text. Okay. Just to analyze. Yeah. See, these are things we have eliminated these 2. Okay, because of absolute words used there. Because in medical field, nothing is absolute. That is the principle. Okay. In medical field, nothing is absolute. Even a medication, you can't give to all the patients, right? Some will have allergy or other things. So basic principle behind this absolute principle is that in the medical field, health field, nothing is absolute. Depends on each. Maybe the same condition. Two patients come with the same condition. Are you sure that you can serve the same injection?
No.
No, because someone may be allergic. So there is nothing absolute in medical field. That is the scientific reason behind this principle. Okay. Now let's read a postmortem consent. A senior member of the clinical team. See what? Why did I eliminate this? What are these?
Between the
subject. Yeah, these are subject complement. Preferably the consultant in charge of the care or anybody else. Preferably that person. So a senior member of the clinical team is important. Should raise the possibility of a postmortem examination with the most. What is most? Most is the scale, right? If you are beginners, don't worry. Okay, I'll be teaching you scale. Now I am not stressing on it. More, you have to raise the possibility of your postmortem. Possibility of your postmortem. Is it after death or before death?
Before death.
Before death. Yeah, possibility. When you say possibility is there, it's before death. So ultimately, the third option is eliminated in the first topic sentence itself. Sorry. Okay. Now, most appropriate person. Second option says allow all relatives. But the topic sentence says should raise the possibility of a postmortem examination with the most appropriate person to give consent. So, when the very first sentence, that's why I said first sentence is the topic sentence, that is the main sentence. If you understand the topic sentence, you understand the paragraph, summary of the paragraph. Especially when there is a gist question, your answer will be there. Okay. Now you see the C and B and C, even if absolutes are not considered, that is eliminated from the first sentence itself. Because it says you should raise the possibility. Possibility means not after death, before death, right? There's a possibility, they say. And most appropriate person means not allow all relatives. It's the only one person. The person consenting will need an explanation of the reasons for the postmortem examination and what it hopes to achieve. So very next session, that is called the supporting sentence. After the topic sentence, you have a supporting sentence. The person needs an explanation, means give a valid reason for conducting the postmortem examination. Correct?
Okay.
The first approach should be made as soon as it is apparent that a postmortem examination may be desirable, as there is no need to wait until the patient has died. Again, they are saying third option is not the answer. Even otherwise, from your general sense, you can understand. Okay? So they are saying there is no need to wait until the patient has died. Here it says only raise the subject after death has occurred. Okay? Many relatives are more prepared for the consenting procedure if they have had time to think about it beforehand. So if you inform them in advance, even before death, they will be more prepared. Many relatives are more prepared for the consenting procedure. So was our elimination within seconds was right or wrong?
Right.
Yeah. Even otherwise, I am not a medical professional. Just think of there is a postmortem. Don't think of death before death or after death. Now there is a postmortem happening in your hospital. Do you think you have to allow all relatives from Germany, South Africa, Nigeria, Bombay, Bangalore the opportunity to decline the consent?
No.
Do you send?
No.
Do you ask everyone in all the relatives? Maybe when you have concluded the list, when you concluded the list, one lady will come that I was his first wife. So you need to take my consent. So the whole process will never end. So absolute, it's not possible at all. Second one, only raise the subject after death has occurred. At times when you have organ donation and other things, what do you do? Yeah, you have to get the consent in advance, right? Even before death.
Yeah.
So from general sense, I'm not saying use your knowledge, but then even from general sense, this is understood. And I always wonder, and that's what I request, if you have any challenging audios, materials in reading, listening, just send me. I'll explain it. Anything challenging. I don't find anything challenging. I keep on searching for challenging materials. I've done with almost everything because nearly 1,000 sessions might have been happening now. I have done with almost all the materials. So anything that you find challenging, you send it to me, okay? When you send it to me, whether reading, writing, or listening, or speaking, whatever material, you have to send it, like reading and listening, you have to send me the key as well. Why? Because when I see the key, I can understand whether it is authentic material or not. So I need not work on it, preparing PPT and all that. At the end, I understand this is not authentic. So always see that you share, even in the main platform, when you have a clarification about reading or listening, see that this is option B is the answer given in the key. Mention it, okay? Don't just send the material. So that gives authenticity. So whatever I feel it's so easy. If you know the strategies, it becomes simply a piece of cake for you.
Sure.
And you said, this is challenging, this is difficult, I am repeating, I am writing so many times. Why should you write so many times?
Sir,
It's a
actually,
high school. Yeah.
actually, sorry to interrupt. Actually, which
Please.
technique you are teaching now? So many teachers which we already faced them, they never taught us in this way. So they are always telling,
That's
okay, listen carefully, think this one, okay. Elimination they are telling, but the basic rules, how to eliminate, they are not explaining in that way. So for us, it seems like always we are telling it's a challenging. But if like in this way, everybody is teaching, so all students, they will feel confident, I feel.
No, we can't blame anybody, because a competent teacher, if he has to teach in any center, he will have to
Yeah,
be paid
everybody has
lakhs of rupees per month.
Yeah.
Yeah. At least more than
Yeah.
10 lakhs. A Cambridge trained trainer, because the most paid teachers abroad are teachers, like health professionals will be next. And nobody can appoint someone who is qualified. Now, you see, I am giving it free, thinking that there are so many people, not for all, especially our focus is for those really struggling after COVID-19. People have lost their jobs, and people are struggling financially and emotionally. Some are struggling, they are depressed. So we are focusing on such people. But when I teach you, I take so much time, but people don't take it seriously. You don't even do the task, you don't give me the notes, you don't tell me what is happening to you, then how do I teach? That's my problem. Now you see, I have spent so much time preparing all these things, sending you messages, notices, all these things I'm doing myself personally. Nothing is automated because it's a free platform. You can spend huge amounts. I don't know whether you know, to run a platform like this, it may require at least maintenance cost will be nearly 20 lakhs per month. It's not that easy. But then we are doing it manually. We have not automated anything. But then people don't respond. People don't respond. Now you see, there are 100 seats. We have been putting the notice repeatedly, the admins and me. But how many have entered? Even those who have entered today, there will be 20 tomorrow. Though out of 20, 15 will want to be there. Some other new 10 members will come. So there is no continuity for learning. That's the main issue. When it is free, people take it for granted. If you have to pay some 50,000 bucks, you'll be serious, right? Any solution for that? Okay. Yeah, I highlighted the same things. Okay, nothing special. This in this slide. Okay. You have to do the same material again. Okay. Don't take a new material. Try to work out the same material. Okay. Yes. Now, next one is straight opposites. We have already seen I am establishing the same thing again. So I'm giving you some more examples. One of them is correct. What is the Malayalam name for this principle?
Kuttatan principle.
Yeah, Kuttatan principle. Yeah, when there are two straight opposites, okay, one of them is correct, which means the other two is eliminated automatically. That's why we call it Kuttatan principle. Okay, when there are two opposites in four options, two are opposites, the other two, not those two, the other two are automatically eliminated, and you have to find the answer from these two. So it becomes so easy. We are taking all these from official materials to prove that these strategies work. Okay, to select the answer, straight opposites, one of them is correct. Now let's see here. Can somebody tell me what is the hedging word in the
Cancer
cancer?
council.
Yeah. When there is a name, that is the most important thing. Okay, normally, and advisors. This is useful when we learn about model verbs. Okay. Yesterday you have seen there was suggestion. Somebody, who is that? Dr. Longo suggests. In the answer there was could and should. Should means suggestion. That will if we are beginners, we'll see later. Okay. But here cancer count. There are many health benefits of alcohol. First option. What is the hedging words?
Health benefits.
Yeah. Health benefits. Yeah, health benefits. Okay. Next, the benefits of drinking red wine to prevent or treat heart disease is conclusive.
Conclusive.
Conclusive. Benefit is conclusive, means there is no doubt. Third one, the evidence that alcohol can prevent or treat heart disease is inconclusive. Inconclusive. Okay. There is a safe level of drinking 1 or 2 standard drinks a day when it comes to cancer.
1 or 2 standard.
Yeah, or safe level of drinking. That's most important, right? Or 1 or 2 standards of drinks a day. That's also cool, but then the safe level is important thing. Okay. 1 or 2 standards drinks a day can be safe or unsafe. Here they say it is safe. Okay. Whatever. Now, Kutaten principle says conclusive and inclusive. B and C are
Straight opposite. B and C are straight opposite.
B and C, yeah.
Yeah. So automatically and D will be eliminated. So, yeah. So now you have only 2 options. You have to find answer from 2 options. Let's check the next one. Yes. Okay. Now you see, read the first sentence. What about the heart health benefits of alcohol? So the topic is heart health benefits of alcohol. The whole paragraph will speak about heart health benefits of alcohol. Well, the evidence is inconclusive. Very first sentence. That's why we call the topic sentence, first 1 or 2 seconds sentence are very, very important. So what is the answer? C option. C, right?
Yes.
Yeah, it is clearly straight away given there. These are official, authentic materials, okay? And do you need to read all these things?
No.
And how much time you require to read this one sentence? First line?
Seconds.
Seconds? Yeah, seconds. Then you say there is no time, I'm getting tense, my goodness, right? Any primary school child will tell you this answer. The evidence is inconclusive. Opposites. One is correct answer. Conclusive and inconclusive are opposites. This is known as elimination. What did you learn about elimination earlier? How are you eliminating the answers? No, people always eliminate, right? People used to say eliminate. How do you eliminate?
Read and break the head.
Yeah, advices.
Yes, sir, Father. My God, thank you so much. Elimination means we don't have any idea about this, because thank you so much.
Reading, repeating and reading.
There is no meaning. I tell you, quantity. If you have seen my videos, most of the videos I am attaching it at the end of the video. 7 things, important things. One is myth about quantity of practice and truth about quality of practice. Don't believe in quantity of practice. Don't worry at all. There are evidences and people have clearly, we have in our channel videos uploaded where people said, I have practiced only 1 reading material full, only 1 material. First they did the ABC part as we give the task, and only 1 material and they got 420. Yes, only 1 material. Whole training practice, the full material is done only 1. Otherwise, like 5 day we have part A, 5 day only part B, 5 day part C. If you do it exactly right, if you do in detail, quality practice, you will be able to. So don't believe in doing too many things. And you hate OET because you get frustrated with all these reading and listening. When you understand, enjoy one reading or one question is enough for a day. Understand, enjoy it, listen it again, repeatedly, at least 5 to 10 times. I don't suggest that you return the same day. At least when you need to enhance your listening skills, you have to repeatedly listen to the audio at least once or twice a day for 5 or 6 days in a week. Same audio. Okay? Then you understand the script. That's also a reading and reading competency practice. Okay?
Yes.
That's it. So you have all the signposts here. One sec, let me check if I can do this. See the Cancer Council advices? Yes. Now the signposts will contrast. ABC is contrast, you understood, right? ABD is contrast. Here it says it is inconclusive. Benefits are not concluded at all. But the first one says there are many health benefits, which means concluded, right?
Yes.
The real answer is nothing is no evidence. Drinking will help you, cancer patients. Second one, the benefits for drinking red wine to prevent or treat heart disease is conclusive. Opposite, right? Again, no meaning. There is a safe level of drinking 1 or 2 standard drinks a day when it comes to cancer. No. No evidence. It is inconclusive. So, A, B, and D options are contrast opposite of C option. Did you understand?
Yes.
The meaning is opposite. Now, signposts. Name, the Cancer Council is the best signpost. Okay, contrast begins with the word but. You don't worry about that, or beginners don't worry. Others will understand. I'm not teaching that deep today because if there are some beginners. The Cancer Council advises that there are many health benefits. Topic sentence says the evidence is inconclusive. The benefits of drinking red wine to prevent or treat heart disease is conclusive. Who advises? That is the advice given by National Heart Foundation, not Cancer Council. Okay? The evidence that alcohol can prevent or treat heart disease is inconclusive. Topic sentence. There is a safe level of drinking. There is no evidence to suggest that. Text says. Now, this is the importance of your, what you call, the advices of Cancer Council. Here, who is advising? This one? The other one? National
Health and Medical Research.
Yeah, National Health and Medical Council. Let me check once. Okay. Sorry. I take you to that. Thanks. Okay. We'll just rework on it. Yeah. See here, we are asked about advice of Cancer Council. But here there is one more. National Heart Foundation. National Heart Foundation advises. Are you concerned about National Heart Foundation advice?
No.
Yeah, so they will confuse you. Maybe the direct one option will be there, one option, answer option will be there, but that is not the advice of National Heart Foundation. Okay, they are asking what is the advice of EduSkills regarding elimination. They are not asking about the advice of some other institute. When they ask what is the advice of EduSkills, you have to find the advice of EduSkills, right? That's the importance of name. So whenever there is somebody else's advice, don't read it at all. You are not bothered. Okay? See, National Health and one more is here. National Health and Medical Research Council guidelines. We are not bothered about it. We are bothered about only
Cancer Council.
Cancer Council. Yeah. That's why, so many questions you will find one name given in the hedging, is the hedging word in the question stem, and there are 2-3 people giving opinions, and they are asking the opinion of one person, especially in reading part C. Hope that is cool.
Yes, Father.
Yeah. And some piece of advice is here. Okay. Remember, answer all questions. Why? Because there are no negative marks. I tell you this, maybe OET and IELTS, these are the only language exams, are the only exams existing now without negative marks. Other exams, competitive exams, if you answer one wrong, whatever the marks you got, you will lose half of it, or 1/3 of it, or 1/4 of it. If you just answer, you don't lose anything. You get it, right? Even you can close your eyes and mark somewhere. Okay. And double check the answers at the end. Very, very important. Okay. Maybe in the stress during, since you have some stress and examination problems, you might know B is the option, but you will mark C. So double check, recheck, and the spellings as well. Don't rush. Don't rush. Enjoy and go. Okay. Rush is not a solution. You can go fast, but don't rush. Read the questions twice. I say you can read the questions twice or 4 times or 10 times. I'd like to type here, read the questions 10 times. No problem. Okay, then you'll not have to read the text. Plan your time. Plan your time means main skill is to skip. You have to skip. You have to practice skipping. Avoid fear. What is fear? False evidence appearing real. Nothing to fear. Yeah, there is nothing to fear. Enjoy. Practice. And if you don't find it easy, practice again. Then practice a little more. Okay? So, do your best. Forget the rest. God will see the rest. Okay? And tasks are there. We'll take for 2 minutes if you have a discussion. Okay? Anything you want to ask me? And what you have to do, you have to find out some material of, you have to do some material and find out the same techniques you have to work. Okay. You have any questions on this? No. Anything you want to ask or discuss? Yes. Your time. If there is energy, we'll go to some more tasks. But then I don't think people will have energy. 6 o'clock, right? 45. I'll just remove the spotlight. Yeah, no smiles. And I have done this with all the 5 materials and most of the listening materials in the official website. Okay. And the OET ebook, the initial part begins, the first volume includes all the 5 materials. I was particular because people are saying, will it work? Many were saying, no, this will not be applicable for all the things. When your father teaches CTCC, when I take up a material, it's not working. So I have done it, explained it in video, in live sessions, and in the ebook, exactly applying the same strategies to all the official materials, which means any materials will kill your competency. Whatever the competency you gained, you will lose it. Yes. Anything you want to discuss, or you can ask. Yeah. Even at YouTube comment space, if you want to. Thank you. Yes, you are welcome. Yeah. Depending on your questions, we may go to something else, explanations. I can find in my hard drive almost everything about OET. So you can search for it when you ask if I want to show some PPTs and explain. I think I'll request.
Father.
Yeah, please.
Father, I am Seema.
Yeah, Seema, good evening. How are you doing?
Since 4 years, on and off trying.
Okay. Seema is from the initial team. Yes, yeah.
I still remembering. I recorded that Malayalam version, no, that time.
Yes, yeah. I think it was, there was no proper light, right?
Yeah.
Yeah.
Then I skip OET. Now again I started. Now since 1 year.
Okay, good, good. Go slow, go slow. You are in UK, right? UK, right?
Yes, yes, Father.
Yeah, recently Lakshmi called me, yes.
Okay. Then actually, I tried since January. Always I am getting writing and speaking, but reading or every time borderline reading and listening.
Oh, many people are getting reading, writing, and writing is actually, as far as I consider, writing is the most challenging thing. Because you have to construct your own sentences, you have to build up your own sentences, you have to build up paragraphs. But here you have nothing to do those things. You have to just read and find the answer. There you have to make your own sentences. Simple sentence, compound sentence, complex sentence. Then you have to construct paragraphs with all the coherence and cohesion, with all the relationship between paragraphs. Those things you have to do by yourself. Here, nothing, just read. This is like copying.
When I am listening, always I am listening the YouTube videos. Then by the time I am getting easy. But I don't know what happened to during exam hall. Really, I appeared almost 4 times here. Then all the time I am getting speaking and writing. These two are always that's
basic thing always I feel one thing, you don't love OET reading and listening.
I love OET and I always
when you
I am
hate
always
OET,
watching your YouTube really.
See, imagine now I am saying here, I love me, Jackson and Anita. I don't love Manju and Nitya. Just for the sake of example, okay? How do Nitya and Manju feel? Bad, right? So you keep on saying writing and speaking is easy, reading and listening is very bad, very bad, very bad. How do they love you, right? They feel very bad. You have to fall in love with reading. And some people say they can even manage listening, but reading they cannot. I don't know how they manage, because if you have competence in listening, definitely you can manage reading. Because reading is easier than listening. Listening accent issues may be there, and you have no extra time. Like you can't spend more time on one question and all that, right? But in reading, you have extra time. You finish all these easy ones first. Okay? Maybe 400 marks if you're competent. In the first run, you can get 400 plus marks. Then you can sit back and see those challenging questions. Then again, you skip and go. And I think I will request OET to give me a chance to write OET.
The problem with the reading, Father, A part, separate, no, that is the only thing maybe for reading.
A part, maybe if you ask Seema, she will tell you. Some people during the first years, like initial years, people have completed within 7 minutes. There are so many who have completed 8 or 10 minutes reading part A and got all answers right. Because it's very easy once you follow those sequence and same thing. That's why I said now I have started with the foundation. Now, when you go back to reading part A, it becomes very easy because you know what is topic sentence, what is the idea, where the idea is, and what are the keywords, what are the synonyms. When you get back into A, it will be easier, much easier. And A is the easiest one, and you get 20 marks within no time. Within 7 minutes, 8 minutes. Still, I remember that Vinny Manoharan, she is in UK. She completed in 7 minutes, hardly 7 minutes. Then she was rechecking. She said she took 2-3 minutes to check and recheck. Then after that, 5 minutes left. She was telling me she was feeling embarrassed because the examiner was looking at her, the invigilator, thinking that this Buddhu knows nothing. And I think she got 430, I think, in reading. And she completed. Then others were thinking that she couldn't answer. She is blinking. Now she has to wait for 15 minutes. So I used to tell them, rest of the time you enjoy and see how others are tensed, how they get stressed. Feel cool down, breathe down, so that you are ready for B and C. You are more confident.
Thank you, Father.
I hope this time I will crack OET. I love OET.
Yes.
Thank you, Father.
But then you say all these things here, but when you go to practice, you will take all the bundles of materials and keep there and start practicing. No analysis of the paragraph, nothing. Only going in, which is the right answer. That's what you want. In the initial stage, you don't think about the score at all. They are not bothered about the score. You should know how did you find the answer? Why the other options are not the answer? Because even those wrong answers has got a strategy. Why they are wrong? Okay? You must understand that. Then it becomes easier. It's not easy. Even if I tell you 100 times, you will go now, take one material. Okay, start practicing. Within 1 hour, I have to complete. Done, done, done. What is the score? Okay, bad or sad? No problem. Yeah. And you say when you teach father, it's easy. When I take up, it's difficult.
Yeah.
See, you have to spend at least half of the time I spend preparing all these PPTs and getting ready with these things. If you spend half of the time, damn sure you will get above 450. Half of the time that I am spending on these materials. I can challenge you. Spending in the right way, not just doing. Spending, you spend a lot of time, years together, working out materials, but not in the right way. Yes,
I am
Shiji?
happy. Yes,
Yeah.
Father, I am happy to say that because I tried to 5 times my OET exam, reading and listening always in same mark. I am depressed last my exam. Writing and speaking is always in good mark, but those two is I am very, actually I am running one institution and another institution and another institution like 2019 onwards. But here now, after your examples and clue and tricks, I am very happy because after I am trying my last time in 2 or 3 materials, I can't express my gratitude for you, Father, because I see I have the examples over here. I within few seconds I finished that. I am very happy.
Yes.
Because
Yeah,
I try like this, Father, because like definition,
okay.
what you say
Right.
about like
Yeah.
that. So
Yeah.
thank you so much because I can crack right now. I am confident because when I was in Saudi Arabia last 11 years, and then on that time because we don't know about how to prepare. You are giving to everyone. This is in a good opportunity for your EduSkills. I am appreciate that, Father. Thank you so much. Even though someone don't have any issue for giving to money to every institutions, anyway they want to pass OET, and so this is you are doing. I don't have any words tell you that because you are great, Father. Thank you so much because
Yeah.
I am very happy.
It's not me. All of us here admins, and it's a platform of the health professionals, by the health professionals, for the health professionals. And I am an assistant here who is not a health professional.
And so I am happy. I am thanks for all. Thank you so much.
Yeah, great. Only thing we have spent thousands of hours I have spent personally from the time of Corona, but it is not reaching to the people. Still, people are struggling. Like we have all the materials possible explained in live sessions uploaded in YouTube. Nowhere you will find such resources. It's impossible to find. But still people don't know. Many of them, like they say, oh, I came to know just last week. I came across your video this week, because we are not marketing. We are not paying money and marketing the YouTube videos. If you market, it will reach. But you can at least like and give some comments so that it reaches. Type something which doesn't cost you anything, just maybe a minute. Some people are doing, admins are doing, and Anita Taji is an example now. Like always, we have such people like in the YouTube and comment space everywhere. They often they comment and say free platform because even today I got so many questions. How many? What is the cost for one module reading? I want only reading. How much should I pay? And how much is the whole program? How long is it? What is the payment? I'm tired of answering this. At least people should know EduSkills is a free platform. But we are not able to reach even that message. Yeah. And it's a hard work of so many health professionals. Majority of them are nurses, definitely. No, it's not easy to build up such platforms. So see that you spend some time, everyone spends some time, reach out people and add people or send me the contacts. No, Shiji's number. Do you receive personal messages from me, Shiji?
Yes,
I
thank you
think
so
your
much,
number is.
Father. Suddenly, I sorry
But I
for
think
giving
some
to.
other.
Back to your answer, because I am eagerly waiting for YouTube to connect. That's why
No, I didn't see your name in the registration in my list.
Because I have two mobiles or three, something like,
Okay.
I am each and everywhere is in different name, Father. Sorry.
Okay. Just send me one message, okay? So that you're introducing yourself, then I can understand in WhatsApp. Yeah, because I was trying to communicate something, I couldn't find your name.
Oh, thank you so much,
yeah,
Father.
Yeah. Cool. Anything else? If you have any doubts, you can ask now. This is also a forum where you build up your confidence, okay? Competence, confidence, God's grace. All these three things are equally important. A good deal of people go, they are confident, but then they are not they are competent, but they are not confident. So they feel frightened, stressed out. They are not able to read or listen anything because they are afraid of. These are the chances where you speak and build up your confidence, even in speaking. And the EduSkills is the only platform where real interlocutors from Kerala used to teach, and there are videos uploaded. Real interlocutors who are taking the exams even today, they have explained what is the speaking module and how it has to be dealt with, all those things. So nowhere else you can find it. Like, so many of them. Other day, Avinash came in here accidentally, like so many people. We have Bronia, different people from different countries. And don't worry about the opportunities. Definitely things will open up within a short period. These are technical politics that's happening. But be prepared. Anytime you can write your exams and go. Yes. Now, when you see one video, there are no opportunities or less opportunities, or there are some problems, immediately so many of them stop learning. Then after some time, everything opens up, they start learning. Then somebody will send one video because they want views. They will say nothing happens. All the nurses will be killed in this kind of that one, this one, that one. Immediately they see that video and close everything and keep quiet for another 6 months. Then somebody says everything is there, beautiful there, they start. And people are also jealous. Those who have gone there will tell you, don't come. Okay. I have seen all these people. Yes. So my basic principle, I used to say, don't learn English for OET. Okay, it's a part of it, but then learn English for life. When after OET, when you go there, you will definitely feel, if you have competency, how beautiful it is. The life is so cool. Yes. And any other concerns that what should we do with the hardly 20 students? My problem is now there are beginners and advanced learners. How to teach? I was thinking of making different batches for advanced learners and beginners. But here, see, when I teach for advanced learners, beginners will not understand. That's why when I was taking up other things, scale, other things, I did not mention. I just mentioned it for advanced learners, but I did not deal it in detail because beginners will be wondering, what is scale? I have one scale, but how to use that scale in OET? Okay. Even if you go to YouTube, Google or ChatGPT and ask what is scale, they will show you all the scales, but nothing about this strategy. Okay. Any suggestions? You have to suggest, otherwise, today again I took up, there were not sufficient students. Still, okay, let me conduct. Because we can go on, if you go on like this, within no time, there will not be people. That's our experience to attend because people feel that they can watch videos. But if the sessions doesn't exist, sessions doesn't happen, videos will not be there. Not only that, watching videos, if you are competent enough, you may be able to manage something. But otherwise, those who are not competent, just watching videos will not help them much. Because they don't know which video has to be watched, what has to be watched. They might watch one video where I speak about all these absolutes, elimination. Then they'll be asking, what is absolute? What is elimination? Yes. Yeah, you can put all those people in the waiting room if they want to ask something. At YouTube comment space, if you want to come and discuss something, you can come here, no problem. For a couple of minutes, I am posting the I'm posting the link again in the YouTube comment space. If you want to ask something directly to me, you can come here at YouTube comment space. If you have anything face-to-face discussions, come on, everybody, give your suggestions, each one. Yeah, let everybody speak at least 1-2 sentences. Our problem is, main problem is, yes, no lady. Yeah, yes, come on.
Sorry.
It's okay, it's okay. Since you asked something, I have
My
to say,
daughter
right?
came to
Yeah.
that's why.
Keep always
Sorry.
keep the audio off always. Yeah. Otherwise, sometimes people will shout at me. You can see in the comment space, what teacher are you? You don't know how to control the students. They are all making distractions. Why don't you mute them? All those rewards I get in the comment space when you disturb. Yes. Yeah, come on, everybody. This is the problem now I am facing. What is your solution? Now, what I'm telling you, now there are some like 27 people, out of which me and 1, 2, 3, 4, 5 admins are there. There's only 20. Out of them, many are beginners, some are advanced, and some of them are new today. Those who are not there in the previous sessions. Tomorrow, these out of 20, there will be 10 others newcomers, and 10 others will not be there. You understand? There is no consistency. Then how do we go with step-by-step training? Or we are just casual things are enough? When it is casual things, I may not go strictly because I am also hectically scheduled. When it is a scheduled program, I might find some time in between my hectic schedules. So Elise wanted to say something. Yeah, you can give your suggestions.
Good evening, Father.
Good evening. Yes.
I joined late today. I was on duty, so I connected from YouTube. But as you said in the starting, that each session is different. We have seen the previous videos, and whatever strategies were used there, now again new things are added. And I used to look on those videos also, previous videos, and I can make out very well that there is great changes. Day by day, our learning, our experience adds on, and we are learning so much. And I am really very thankful to you, Father. Because of you only, we have developed so much confidence that yes, we can score A. Thank you so much.
Yeah, you are most welcome, but you haven't dealt with the problem. We have a problem now. You have to suggest solutions as well. Problem is we are not able to go focus on a batch and train. What should we do? See, I have a lot of uneasiness when I teach in a mixed group. Like some are beginners. They don't know anything about OET. Like they don't have even an introduction about OET. Maybe the beginners do not know how many subtests are there. So others are advanced. So how to put them together and teach? And the number is so less, we cannot bifurcate. We can't segmentize or put into batches. You are welcome to add your suggestions and your compliments, but at the same time, add something on solutions as well. Elise, do you have any solution on this?
So, Father, we have to send message continuously in the group so that it will come as a pop-up and the people will know. Earlier also, I was not knowing that this is a free platform, frankly to say, that as this platform is from the long back, but last year only I came to know that this is the platform. And seriously, if I want to say that I was not knowing how to interact, how to participate in discussions, how will be the daily task. But after joining the July batch only, I came to know how to participate in the different activities. So I was thinking that during discussions, we have a panel discussion type and every member will be on the Zoom. So I was not that much confident for the technology actually. So this is the issue. Most of us are not that friendly with the technology. That's why we are lacking the skills. But now we are confident that we know how to participate.
Yeah, the problem is like, for example, we give you the link earlier, but people don't even, some of them give 5, 6 messages. Sorry, there is some instrument disturbing. But some of them don't even want to send a message. See, more message you send, more chats are there. People find this live when they open the YouTube. Like, no, accidentally that pops up. Now you see here the chat rate is just 3. Chat rate is just 3 in our YouTube comment space today. So people don't even want to send a heart, say like, or just click the like button. How many have liked today? Just 53 out of 308 people who entered this platform during this session. Out of 309 people, only 53 people liked it. Just click the like button. And out of 390, more 90% people have left even within the sessions. Okay, so you'll have to reach out some more otherwise I'll be helpless. It's ethically I will be helpless. As I said yesterday, when there are greater things which I have to do, if I ignore it and come to the lower things, I'll be accountable with God. So because you have, everybody is in a nursing group, right? Definitely. You have your own nursing groups, right? But nobody wants to share or add those people. See, we have taught you how to add people. You don't lose anything. They are free to exit if they don't want the training. But people may not know, right, where to reach. And you see in the platform, so many questions are coming, how to attend Zoom session, how to attend. I have to answer. When you don't answer in the platform, everything comes to my phone, thousands of messages. And I have to answer personally. If you answer those questions, at least I can save more time and give you more sessions, which you don't do. Most of you don't do. Which you know. For example, you know the answer. Somebody is asking how to attend Zoom session. You can just type in or keep a message, type in your pseudo folder somewhere saved and copy and paste. Please click on the link, YouTube link, and you will join there. Then you will get the Zoom link there. Those who know can type in, right? So that I don't get disturbed and distracted with a lot of messages in my phone. And sometimes, some people cry and I'll have to answer. So I'll be wasting my time. I'll be wasting time on lesser things. Yes, keep smiling. Anybody else? Any other suggestions?
You are not wasting the time, Father. You are doing some great job. And someone is getting the help from you. It's not like it's you wasting your time.
No. What I meant is What I meant is when I send personal message responses in the main platform or here, which anybody can do. For example, how to attend the Zoom session, or is it should I pay something here? If you answer, I need not answer. Like you, maybe 50 of you, 1 answer, 2 answer you'll be giving. But I'll have to answer 50 people alone. That will be a waste of time, I said, not the teaching. See,
we will keep that in the mind and we will do that for you.
Yeah, even in the YouTube comment space, they ask how to join. You can give my number. Send a message to WhatsApp, a message to Father Saleen, Joseph. And then you can just post my number there, 9448441393. So that they will send a message, we will add them. And we'll register their name. But then even when I go to YouTube, I don't find anybody responding, anybody liking. No, people will feel comfortable when their message is seen. Anybody can do it, no issues. Then it will reach to more people. Then more people will come here. The second thing what I said is ethically, you are supposed, when there are 2 good things, when there are bad things, you have to, bad and good, you must choose the good. When you have 2 good things, you have to choose the greater good. If I am spending time with the 10 people here, if I can use that time and assist 100 people, those who deserve more, that will be the greater good. That's what I said. It will be wastage. Ethical concerns. Yeah. But I know somebody will be helped. But we are concerned about really struggling people. But most of the time now we see all high-fi people. Like
you are mentioning about the beginners are coming here. I don't think so that a lot of beginners are coming there. Beginners elsewhere, they will go and try and fail. Then only they will come to you. That's a fact.
Yeah, there are beginners, even those who have just passed last year and all. So many have even they have come here first. Those who come here first, they will they go in their track properly, because we have so many students who have come fresh after their BSc nursing, They have all passed in the first attempt from our experience. Now, the problem of unlearning, when you go to other institutes, then unlearning. As I said, now practice means you have to practice 3-4 readings every day. That is in your brain. And how many score? We teach them not to think of the score. We give them only 5 days, only reading part A, which they don't understand. 1 day, only reading part A, no B and C. And next 1 week, only reading part B. Next 1 week, only reading part C. That's the right way. But then these people feel I'm not doing anything because I've been practicing at least 2-3 materials, reading materials every day, or I was doing all the 4 modules every day. Now I am not doing anything.
No, the volume is not going to help you.
Yeah,
the volume doesn't help because even my experience, I improve my timing with your course and tips and tricks. When I start using that, I'm easy to making the time to do. Even 10-12 minutes, I will finish the part A. Even the B and C combined together, I will get some time to.
Yeah.
Yeah, that's
now
what I'm getting.
Yeah.
The tips will help
Yeah.
always. Not I know it's as you say, it's not gonna get the time to do everything in that limited time. If you're reading in a certain way, the other people will say.
Yes. Now, at least we are 29 people, excluding me here. Can you think of reaching out to one person in the whole world? For sure. Reaching out to one person. Maybe you'll have to reach out to more people so that you ensure one person. I want to see that one person, but don't book all people one person. Somebody from outside, one person, target one person, so that we have some more people, so that we take them in the right track. And we have to start tasks. We have not started tasks because if you start, those who come in again, they will find it challenging. Okay, I don't mind even giving a summary session only for them, those beginners. So make it a challenge that you reach out to at least one person in this whole world. If possible, really those who are struggling financially or emotionally, if you know. And let me know personally, send me the link and the number of the person and ask them to go and comment in the YouTube comment space. And I will register the name. Okay? At least one. It can be more than that, but at least one, so that we have at least 50 people next time. You know, again, I'm telling you, this is a hard-earned money. I am spending most of my allowance here on the expenses, whatever I get, because I don't have a family. I did not spend all you are my family members. I am spending on you. I don't regret it, but everything costs. Even, you know, Zoom platform, premium platform costs. You have to pay rent, monthly rent. Even Telegram management, tech team has to be paid. So many, we have one person we could not pay the 15,000. The whole platform was members were doing it. At least they were assisting me to edit and other things. But I am doing it alone now. Because if you don't upload it, edit it, there are some privacy issues, copyright issues, all these things are there. So if you don't upload it, like those people may not benefit. Now I can say you watch all these things. Live, it is okay. Most of the time we don't conduct live. Now, because initial sessions we conduct live, because those who come late, at least they can watch it immediately. Because if it is to upload, edit and upload, I may not have time within this short period. It may be delayed. Then they cannot go into the previous videos and come back when the beginners come. That's why we initial stages, only we have live sessions. Then we have only Zoom classrooms. Because that will not be, yeah, please.
Father?
Yes,
Father,
please.
I have a question, please.
Yeah, please. Come on.
Father, I'm talking from Pakistan, and Father, I have concern regarding Telegram. In the Pakistan, Telegram app is not working, and I'm really struggling for to take a daily task. I can't get the daily task to do for my practice. Kindly tell me how can I take this the task so that I can prepare myself for the OET. Please guide me.
The Telegram is the main platform because, you know, WhatsApp and all the things have got limitations. Here you can have lakhs of people in one group. One thing is that. Secondly, only for those people like you who cannot access Telegram at all, we have WhatsApp communities where our admin Anita Taj is posting every notice, everything. She is updating. Those community groups are meant for you. Okay, you can follow there. May not be 100% perfect, but definitely you will get all the session details, links, Everything you will get there because one admin is exclusively doing that task. Whatever I post, whatever we post in the main platform, it is being posted there. Okay. But then that is not the ultimate place because all these discussions doesn't happen there. What happens in the main platform? Discussion and clarifications, tasks. Tasks will be given there, but discussions and clarifications will happen here. That's the only disadvantage. Otherwise, basic information. See, if are you a member of any WhatsApp community? We have 5 communities. Hello? Who was that? Who was that? I couldn't find the person.
Okay, Father.
I
But
can.
Father, I only get there the videos of the previous sessions, but I want to take the task that you give us for practice.
Yeah,
For
task.
example, the
Task.
strategy that you teach us today, and in the previous sessions you said to me you said to us that you give the task for the these strategies to so that we can practice. So, Father, I want to take that task so that I can prepare myself for OET exam as soon as possible. It is very necessary for me, sir, Father.
Yeah, now, my friend, now tasks have this batch tasks we have not started. Okay, this is only foundation program where we have not given homework or task, which will start shortly. When we are starting, you will get it in the WhatsApp community. All the tasks, daily tasks will be given, posted in the WhatsApp community. All the 5 communities. Did you understand? Hello?
Hiram, are you listening?
Hiram, you are supposed to unmute your video because that's the basic respect you do in the platform. That is a discipline. See, I couldn't see you because you did not unmute. I am speaking to a blank screen. Okay. Yeah.
Yes, Father. Thank you.
Yeah, at least in the YouTube, this one Zoom classroom,
Yes,
you are
Father.
supposed to unmute your video. Otherwise, you will not be admitted next time by the system. Because there are so many spammers coming and disturbing and misusing the opportunities and creating problems. Okay. So that will be posted. Okay. If there is a batch, things will be posted there. Okay. In the WhatsApp community. Are you a member of any WhatsApp community? EduSkills WhatsApp community? Ram. Am I audible? Hello.
Father, yeah, she's switch on her video, Father, now. Maybe some.
Yeah, I can see her, but I am asking her, but she can't hear, I believe.
Maybe network problem, maybe.
Yeah, somebody is texting me, telling me that they got my number from EduSkills, but I don't find him
Yes,
in
Father, you are audible,
Yeah.
but in my mobile phone there is some issue, so.
Okay. Okay. Now there is somebody posting. Yeah, don't respond to any of the personal messages saying that they are from EduSkills. EduSkills
Father,
will not.
because in the mobile phone there is no maybe.
Okay, cool. It's okay, ma. Hope you heard it. That's cool. Now somebody is messaging in the YouTube comment space. Somebody is sending personal message saying they are from EduSkills. From EduSkills, only me and the admins. And mostly personal messages will come only from me. You know my number. And any other message is a spammer. Immediately block. Don't go to interact at all. Why do you take unnecessary troubles? And we have not allowed anyone at EduSkills to send personal message to anybody to save your own privacy. Okay. Messages are all in the common groups or platforms, not personally. And only links and main things, if you have registered your name, I will be sending you personally. Me sending from my number. Okay. Yes. So don't worry about those messages. All those are spammers. Yeah. Hiram, your thing will be solved provided you reach out to at least one person and come back. If you have sufficient people, reasonable people, we'll continue with the batch. Otherwise, as I said in the notice, for example, we have a big rush for IELTS training now. So I'm planning to start one batch. So your time will be shared because there are so many waiting since 2-3 months I could not do any sessions for them. Yeah. Anything else you want to add, or everybody is supposed to speak at least one sentence? That's a speaking practice for you.
Father, it is a humble request.
Yeah.
Please give us coaching for this till December at least, as per your timings.
No, the thing is,
Because 2 times I tried, but I am not getting any Zoom sessions, unfortunately.
no, Zoom sessions will be always there. But then the problem is that today, you see, after so much of struggles by admins, and those of you here, out of you, 7 of us are like admins and me. Only 15 students are there. And this type of training may not be helpful for everybody because different category of students are here. So if it is to be powerful and effective, we need those who are like beginner separate and advanced separate, all those things. Like those 4 subtests, if you are taking, you have to give from foundation. That's not required for only those who want reading training. Some of you want only reading training. When we reach writing and speaking, there will be 2 or 1 aspirant in this batch. How to continue the training? How to continue the batch? Even last batch, we stopped with writing because the admin said nobody is responding. There is nobody, really no one to attend. You understand? Because majority of you want only reading. Okay, some of you want only listening. Some of you want reading and listening. Some of you want all the 4 tests. Some of you are beginners. Some of you are repeaters. All those different types are here. And you have more than like 15 or 16 aspirants. So today you are here. Maybe 2 or 3 will be here every day. Others will keep on changing. Some other newcomers will come tomorrow. How to teach them? How do they know? If I know, okay, these people are attending step by step all my sessions, I know exactly when I explain, they understand these things. Do you get me? Now, immediately there will be messages in my phone. Father, I did not understand. You said there's something scale there. Father, you did not understand. I did not understand what is absolute. Because they don't understand, because we are referring to the previous class, right? I have sent a special message when you come to the next class. If you have not attended any of the previous sessions, please at least watch the video and come. But people don't watch. That's the practical issue. Otherwise, there is no issue for me to help you as much as I can. But to reach 16 people, I might have spent more than 10 hours. Just imagine. And how many times I have spent twice to more than 2,000 newcomers, the new registrations I have spent, more than 2,000 people twice message about this session, personally. Though it is broadcasted, it's not easy. To send into 15 groups, it takes a lot of time in my phone because phone doesn't respond very fast because of contacts, no? So many contacts and so many messages. It's hanging. Now, if I don't send personal messages, even reminding, somebody has said, no, immediately they sent me message, I forgot really, I have the confusion of time, all those things. But before 10 minutes, again, I sent personal message to everybody saying that it starts in 10 minutes. Is it possible always? It's not sending to one person, to thousands of people. I don't know who is coming from where. They don't respond. Majority, 99%, don't even respond saying thank you or a thumbs up. So I don't know who are responding, who are coming here. Whom should I send? These are the practical issues. To get 15 people, I have to struggle so much. Where I have 170 students here, if I give them one session, they'll be so happy. Live sessions. I'm taking care of 170 students. Okay, youngsters. I'm sacrificing their time and sitting here. I'm not complaining. Do you understand the situation? So what happens when there is no proper response? Natural human beings, what happens? Okay, we will cancel tomorrow. We will not have session. We'll have this session. We will not have that session. That's natural. And when you think many of them are your experts here, they can teach you. They are admins here. They don't require this training. They are here to assist me and you, admitting you, taking the list, and so many things are happening. I said only my work. Then admins are taking their list, admitting you, all those things are there. And how many times admins have pinned the message in the groups? More than 20 batch groups and other different groups about this session. All these, they are also ethically scheduled. Every admin is working. They have their family responsibilities. They are sitting here. Even those who have passed, they come and sit here for 2 hours, 3 hours with you. They don't require. They are well settled abroad. Yes.
Thank you, Father. I saw last 2 days onwards, I am standing inside this this our group. So we are waiting. My other colleagues also waiting. They are asking me when class. So I already called them to join. Early morning 4 o'clock we wake up and sitting in front of the mobile, but that cancelled yesterday. So I and then my colleague said to me, I go back, Chechi, because we are because they are night duty finishing and they are waiting. But today they also class, your duty. That's why they did not attend our class. But I am encouraging them to come in our, because we are needed, because we need
anywhere. That's why I said if there are 30, at least 30 members, you can fix your own timing. I have no issue. I can adjust. Even it's midnight, I can adjust, provided people are benefiting. I don't mind for many people if they are benefiting. That's why I said you can create your own group and suggest your timings. No issues. Earlier we had Gulf sessions, like only for Gulf people. We had UK timing sessions. We had 9 in the Edu Skills. We had 194 batches at a stretch. It was running that way. Many groups could join one time, so we gave them the preference. Now that's why I kept sometimes in the 4:30 now, sometimes 6 o'clock, sometimes 8 o'clock. Different timings we are keeping to see which timing is convenient. But then now you say you are friends all together. If you can, even in the group, we can discuss and find out a particular time. It's cool for me. Maybe morning, my prayer and mass time I cannot sacrifice. Other timings are cool for me.
Thank you, Father.
Anytime
But
we can
we are
adjust,
waiting, Father. No problem. We are coming to your time. No problem for us. But sometimes I am very sad about that canceling, because I know that.
Because no people, like yesterday, if we had to have it, it will be more less than 10 people. Because we know the response from the YouTube comment space, no? Even if you go there, you can see I think everybody can see it, right? Comments of the people.
Yes.
Okay. Yeah. You can easily make out. That's why I gave you the notice. Just visit there till 3 o'clock. How many are there? Okay. Then you can decide whether there will be session or not without a notice. Yes. That is cool. But then, Shiji, you can try if you are a good number. Even if it is 20 people, we can think of a timing. No issues. Others will join. It's okay. Let them. Like those who are not serious can adjust and join. No problem. Let them. Okay. But we want to see.
Thank you.
Even if there are 15 people who are regularly joining, it's easy to teach. It's easy to prepare. We can go step by step. Others will join or they will watch the videos. So we can keep your convenient timing. But you can even discuss in the batch group or main platform and make a group and say, okay, we are going to attend at this time. Maybe this week, this time, next week we have duty shift, and next time it's okay. Provided I know in advance. I can take you till the end, no problem. But then now to get the people and arrange the sessions, I am spending more time than taking sessions. Yes, that is cool. Okay, keep going. Nothing else, I believe. Anything, admins, any message to be passed? I think we'll at YouTube comment space. We are concluding now.
Father,
okay, you're welcome. Yeah, please.
What about us who want to crack OET?